So here with me now to discuss the state of the pandemic amid this ever-changing political landscape is clinical professor of cardiology at Mount Sinai School of Medicine, Luiza Petre. So Luiza, it's a real pleasure to have you on the program at a time too where there does seem to be a promising development when it comes to a coronavirus vaccine. What would this mean, for example, if this vaccine were to be able to be released to the American people?
Alex, we initially learned about a deadline around Thanksgiving for emergency authorization used by Pfizer ago. What we learned yesterday from Pfizer Independent Review Board, they just released the efficacy data, which is 90%. From a scientific perspective, that's a very good number, considering that the flu has only 60% efficacy. And that's 90%, it's way higher than expected. There are also a few relevant points there. It confirms that the protein spike that was chosen for these vaccines was the right successful target. And second, it's a new technology, Moderna using the same one, which could resonate in the future for more vaccines development because it's a completely new technology.
And the 90% number, I think, is important to note because it ensures trust among people who may be willing to take that vaccine. I know that there are some concerns because this was such an expedited process. I mean, typically a vaccine takes 10 years to come out. I think the previous record is 4 years, and here we are looking at a vaccine that's taken less than a year. So I understand why there's some hesitancy, but that 90% number comes as good news for many Americans. Would this really be a possibility for a lot of people, and I guess the country as a whole, to return back to normal, as the way people like to put it?
Alex, this is just preliminary data. Keep in mind that the trial will continue and probably will have more accurate information, more exact numbers as we follow these patients more. But to your question, to return to normalcy in every pandemic, a vaccine is paramount because that's the only way you can break the spread of infection at a larger scale.
And so when we look at this vaccine, because you say that the whole point of this is to make sure that on a larger scale, we are good to go, it's for my lack of medical terminology. But when it comes to the rollout of a vaccine as well, I know that there's still tests that have to be done. I know that, for example, Dr. Anthony Fauci said we may not be seeing it until next summer at some point. But then, for example, we've heard other administration officials say that it could be by the beginning of 2021. What would a rollout of a vaccine actually look like once it is deemed to be safe?
As we know, initially we'll have just limited doses. Most likely they will be allocated. So we're looking actually to see three things in this process. We'll have allocation. First would be the healthcare workers and frontliners, and then we'll follow up with high-risk individuals and immunocompromised, jails, military, to roll out later on to young adults and children. So allocation is number one. Number two, we're going to see centers of distribution, probably clinics or pop-ups that would maybe they will partner with large chain pharmacies. Also, we are going to see in this process a national registry because we have to monitor what if someone moves from one state to another and needs a second dose. It has to be a system to track those people.
So there is going to be a prioritization based on people who probably need it the most, as you were saying, frontline workers, maybe start with elderly people who may be more vulnerable to the disease and then make its way to a broader type of image. But I think that there is something right now that goes underlooked a lot of times. I know that, for example, suicides have been up, depression's been up. There's people fear that perhaps child abuse hasn't been reported the same way because there's these lockdown orders, and oftentimes that's first reported at school, things of that nature. So from a public health standpoint, I know that the coronavirus pandemic takes center stage and all that, but where does America stand right now? Are we seeing maybe a decrease in flu numbers or an increase in other type of things? Where does the public health standpoint look like right now?
If we look at the big picture, COVID, of course, predominates the news. What we have learned over the last 7, 8 months, people do avoid routine medical care. And concerning, actually, for example, mammograms and pap smear screenings went down 80%. If we look at the excess mortality, we are seeing numbers in 300,000 range. What that tells us, there are a lot of deaths indirectly related to COVID. People who had heart attacks, strokes, they did not seek medical attention on time. So the consequences are, of course, beyond the COVID itself.
And that is a problem as well. I mean, I'm not trying to downplay coronavirus or anything like that. I know that it's the pandemic that's affecting this country right now, but that doesn't mean that other health concerns necessarily get put to the side. Otherwise, you may be doing just as much harm as if you were to be keeping that person safe from coronavirus within itself. So before I let you go, what is some maybe health advice that you have for people who may be a little bit hesitant right now, maybe a little bit scared about what's going on across the country? What's your advice for them?
From a perspective of prevention and avoiding the spread of this virus, what I suggest we do have to go to our basic toolbox. And we do know masks do work. We know that social distancing works. So we have to remain functional. No one wants to go back to lockdown. It's just going to those basic measures.
I think that's good advice. I think that, we know that lockdowns take a great toll on a lot of people's lives, but at the same time, when it comes to something like wearing a mask or just staying 6 feet apart if you can, I think it's good advice for everyone. I've also heard other doctors say, make sure that you still do get your exercise in, make sure that you are eating right, drinking water, things of that nature. There are some things that we have in our control, even though a lot of the situation seems like it's out of our control. But Luiza Petre, I really appreciate you coming on the program tonight, giving us an update on what this all means. Thank you.